Many years ago, I started working at the West Suffolk Hospital in the catering department after leaving college. I worked in catering for nearly 10 years. During that time, I got to develop an appreciation of the different roles within a hospital and developed an interest in those roles. I've always enjoyed working with people, and nursing seemed to me to be the epitome of a job where you could work with people for their best interest. After I finished working in catering, I took a career break when I had my children and used that time to go back into education to get relevant qualifications to start my nursing career, which I started in 2004. I worked on a surgical ward for 4 years and then went on and worked in the endoscopy department for almost 12 years. During my time within the ward and in endoscopy, I learned and appreciated and witnessed the role of the CNS in patient care. And I felt towards the end of my time in endoscopy, it felt like a natural progression in my career to investigate that role and see if I could become a upper GI nurse specialist, which I started this job 3 years ago. I felt the base I had was solid, but obviously taking this job, you've realised that the job was much vaster than I ever first appreciated. It has been a continuing developing role, and I think it will continue to be a developing role for the rest of my career. Our role is quite wide. We will receive referrals from GP practices with patients with symptoms that could be suspicious for a cancer of the upper gastrointestinal tract. When we receive these referrals, we contact the patient by telephone and introduce ourselves and explain briefly about our role and ask them about the symptoms they've been experiencing, a bit about their lives and people around them. And from the information we get from the patient, we will start to establish investigations they may need to investigate their symptoms. Once they normally would include CT scans, MRI scans, or endoscopy procedures. At that time, we will give that patient a timeline of when they can expect these procedures to take place and investigations, and when they should hear the results back. We meet patients in endoscopy and in clinics with a suspected cancer of the upper gastrointestinal tract. We usually meet with patients and their family or significant other with a consultant where we inform them of our suspicions for a diagnosis of a cancer. And I see our role is to be supportive to that patient and their family member, to offer information, support and knowledge to help them with their own decision making, and hopefully let them know that there is somebody taking their care as a priority, and provide contact details so they know with any questions or concerns they can contact us and we will be their first port of call.